I think the social prescribing approach brings a totally different attitude towards looking at people with mental health issues. I think it gives them an opportunity to look at more deeply at the issues that are maybe troubling them, and they're navigated to specific services that are more applicable to their needs. We were looking at the prescriptions rate in the Lochgelly area, and the prevalence was quite high, so we thought the social prescribing model would be a good model to use to look at reducing the prescription rates and looking at avoidance as well.
We've now got something we could do to start to address our mental health problems in Lochgelly. The social prescribing model actually gives us something more than just a prescription. It gives us something that we could all, as a community, start to focus on and start to work on and start to address and talk about mental health problems.
The infrastructure has been developed through, working very closely with the voluntary sector, statutory organisations and community organisations as well, looking at having clear referral pathways to these organisations, looking at what we can offer, what they can offer. It's a sharing of skills and knowledge.
What we need to do is kind of break down some of the silos in which people work within our community. So in Lochgelly, we've formed a steering group around the social prescribing pilot, which has got all the agencies. Everybody effectively comes to the table as an equal partner in delivering the social prescribing pilot, and everyone's got a benefit from that. So I think the buy-in has been relatively straightforward.
I think what's helped clients buy into the approach is the initial meeting with the GP, then the meeting with myself as a health coach, and sitting, listening to them and talking to them and finding out what their priorities are and navigating them through that.
We've identified that the befriending advocacy type support that we're providing is something that we want to enhance and make sure that that's there, because the reality of the situation is, for some of these people, finding their way through these services is quite difficult, and what we want to do is provide almost a mentor to help and support that person as they move through their recovery and start to address the issues, their underlying issues that they have. Key to that is the social prescribing health practitioner, and making sure that they've got the right connections and they've got the right support from all the agencies that they need, because the more support that we give the health practitioner who's dealing and working with the patients, the better recovery that we're going to see for our patients.